Sciatica. Sciatica is a term used to describe nerve pain in the leg that is caused by irritation and/or compression of the sciatic nerve. Sciatica originates in the lower back, radiates deep into the buttock, and travels down the leg. What does sciatica feel like? The symptoms of sciatica are commonly felt along the path of the large sciatic nerve. Sciatica is often characterized by one or more of the following features. 1. Pain. Sciatica pain is typically felt like a constant burning sensation or a shooting pain. It starts in the lower back or buttock and radiating down the front or back of the thigh and leg and/or feet. 2. Numbness. Sciatica pain may be accompanied by numbness in the back of the leg. Sometimes, tingling and/or weakness may also be present. 3. One-sided symptoms. Sciatica typically affects one leg. The condition often results in a feeling of heaviness in the affected leg. Rarely, both legs may be affected together. 4. Posture-induced symptoms. Sciatica symptoms may feel worse while sitting, trying to stand up, bending the spine forward, twisting the spine, lying down, and/or while coughing. The symptoms may be relieved by walking or applying a heat pack over the rear pelvic region. It is important to note that any type of lower back pain or radiating leg pain is not sciatica. Sciatica is specific to pain that originates from the sciatic nerve. Sciatica is the symptom of an underlying medical condition. Sciatica is a term used to describe a set of symptoms caused by an underlying medical condition. It is not a medical diagnosis. The terms lumbar radiculopathy or radicular pain may be used interchangeably with the term sciatica. The sciatic nerve is the largest single nerve in the body and is formed by the union of 5 nerve roots in the lumbar and sacral spine. There are 2 sciatic nerves in the body, the right and left nerves, supplying the corresponding lower limb. A few anatomical characteristics of the sciatic nerve include 1. Origin. Starting at the level of the spinal segment L4, the sciatic nerve is formed by the merging of spinal nerves roots from L4 to S3. The emerging nerve roots converge into a single sciatic nerve, making it large and bulky, typically up to 2 cm in diameter. 2. Path. After its individual contributions end, the sciatic nerve exits the pelvis through the greater sciatic foramen, below the piriformis muscle. The nerve then runs along the back of the thigh, into the leg, and finally ends in the foot. 3. Branches. The sciatic nerve branches into 2 main divisions behind the knee, the tibial nerve and the common peroneal nerve. The tibial nerve courses down and supplies the back of the leg and the sole of the foot. The common peroneal nerve supplies the front of the leg and foot. Sciatic foramen. Rarely, the sciatic nerve may split into 2 nerves near the sciatic foramen, which merge again into a single nerve. The specific sciatica symptoms largely depend on the nerve root that is pinched. For example, an L5 nerve impingement can cause pain in the back of the thigh and weakness in lifting the big toe and the ankle. The course of sciatica. Often, a particular event or injury does not cause sciatica, rather it tends to develop over time. Sciatica affects 10% to 40% of the population, typically around the age of 40 years. Sciatica is found to be common in certain types of occupation where physically strenuous positions are used, such as machine operators or truck drivers. Specifically, people who often bend their spine forward or sideways or raise their arms frequently above the shoulder level may be at risk of sciatica. The vast majority of people who experience sciatica typically get better within 4 to 6 weeks with non-surgical sciatica treatments. If severe neurological deficits are present, recovery may take longer. An estimated 33% of people, however, may have persistent symptoms up to 1 year. When severe nerve compression is present with progressive symptoms, surgery may be indicated. When sciatica is serious, certain symptoms of sciatica may indicate a serious medical condition, such as cauda syndrome, infection, or spinal tumors. These symptoms may include, but are not limited to, progressive neurological symptoms, such as leg weakness, symptoms in both legs, bowel or bladder dysfunction, sexual dysfunction. It is advised to seek medical attention immediately if such symptoms develop. Sciatica that occurs after an accident or trauma, or if it develops in tandem with other symptoms like fever or loss of appetite, is also cause for prompt medical evaluation. Sciatica symptoms. Common symptoms of sciatica include lower back pain, pain in the rear or leg that is worse when sitting, hip pain, burning or tingling down the leg, weakness, numbness, or a hard time moving the leg or foot, a constant pain on one side of the rear, a shooting pain that makes it hard to stand up. Sciatica usually affects only one side of the lower body. Often, the pain extends from the lower back all the way through the back of your thigh and down through your leg. Depending on where the sciatic nerve is affected, the pain may also extend to the foot or toes. For some people, the pain from sciatica can be severe and disabling. For others, the sciatica pain might be infrequent and irritating, but has the potential to get worse. Medical attention. Seek medical attention right away if you have fever and back pain, swelling or redness in your back or spine, pain that moves down your legs, numbness or weakness in the upper thighs, legs, pelvis, or bottom, burning when you pee or blood in your pee, serious pain, loss of bladder or bowel control, leaking or not being able to make it to the toilet in time. What are the risk factors for sciatica? You are at greater risk of sciatica if you 1. Have an injury or previous injury. An injury to your lower back or spine puts you at greater risk for sciatica. 2. Live life. With normal aging comes a natural wearing down of bone tissue and discs in your spine. Normal aging can put your nerves at risk of being injured or pinched by the changes and shifts in bone, discs and ligaments. 3. Are overweight. Your spine is like a vertical crane. Your muscles are the counterweights. The weight you carry in the front of your body is what your spine, crane, has to lift. The more weight you have, the more your back muscles, counterweights, have to work. This can lead to back strains, pains and other back issues. 4. Lack a strong core. Your core are the muscles of your back and abdomen. The stronger your core, the more support you'll have for your lower back. Unlike your chest area, where your rib cage provides support, the only support for your lower back is your muscles. 5. Have an active, physical job. Jobs that require heavy lifting may increase your risk of low back problems. The use of your back or jobs with prolonged sitting may increase your risk of low back problems. 6. Lack proper posture in the weight room. Even if you are physically fit and active, you can still be prone to sciatica if you don't follow proper body form during weightlifting or other strength training exercises. 7. Have diabetes. Diabetes increases your chance of nerve damage, which increases your chance of sciatica. 8. Have osteoarthritis. Osteoarthritis can cause damage to your spine and put nerves at risk of injury. 9. Lead an inactive lifestyle. Sitting for long period of time and not exercising and keeping your muscles moving, flexible and toned can increase your risk of sciatica. 10. Smoke. The nicotine in tobacco can damage spinal tissue, weaken bones, and speed the wearing down of vertebral discs. Is the weight of pregnancy the reason why so many pregnant women get sciatica? It's true that sciatica is common in pregnancy, but increased weight is not the main reason why pregnant women get sciatica. A better explanation is that certain hormones of pregnancy cause a loosening of their ligaments. Ligaments hold the vertebrae together, protect the discs and keep the spine stable. Loosened ligaments can cause the spine to become unstable and might cause discs to slip, which leads to nerves being pinched and the development of sciatica. The baby's weight and position can also add pressure to the nerve. Sciatica during pregnancy. The good news is there are ways to ease sciatic pain during pregnancy, and the pain goes away after birth. Physical therapy and massage therapy, warm showers, heat, medications and other measures can help. If you are pregnant, be sure to follow good posture techniques during pregnancy to also ease your pain. What causes sciatica? Sciatica can be caused by several different medical conditions including 1. A herniated or slip disc that causes pressure on a nerve root. This is the most common cause of sciatica. About 1% to 5% of all people in the US will have a slip disc at one point in their lives. Discs are the cushioning pads between each vertebrae of the spine. Pressure from vertebrae can cause the gel-like center of a disc to bulge, herniate, through a weakness in its outer wall. When a herniated disc happens to vertebrae in your lower back, it can press on the sciatic nerve. 2. Degenerative disc disease is the natural wear down of the discs between vertebrae of the spine. The wearing down of the discs shortens their height and leads to the nerve passageways becoming narrower, spinal stenosis. 3. Spinal stenosis can pinch the sciatic nerve roots as they leave the spine. Spinal stenosis is the abnormal narrowing of the spinal canal. This narrowing reduces the available space for the spinal cord and nerves. 4. Spondylolisthesis is a slippage of one vertebra so that it is out of line with the one above it, narrowing the opening through which the nerve exits. The extended spinal bone can pinch the sciatic nerve. 5. Osteoarthritis. Bone spurs, jagged edges of bone, can form in aging spines and compress lower back nerves. 6. Trauma injury to the lumbar spine or sciatic nerve. 7. Tumors in the lumbar spinal canal that compress the sciatic nerve. 8. Piriformis syndrome is a condition that develops when the piriformis muscle, a small muscle that lies deep in the buttocks, becomes tight or spasms. This can put pressure on and irritate the sciatic nerve. Piriformis syndrome is an uncommon neuromuscular disorder. 9. Cauda equina syndrome is a rare but serious condition that affects the bundle of nerves at the end of the spinal cord called the cauda equina. This syndrome causes pain down the leg, numbness around the anus and loss of bowel and bladder control. Complications of sciatica. Although most people recover fully from sciatica, often without treatment, sciatica can potentially cause permanent nerve damage. Seek immediate medical attention if you have loss of feeling in the affected leg, weakness in the affected leg, loss of bowel or bladder function. Prevention of sciatica. It's not always possible to prevent sciatica, and the condition may recur. The following can play a key role in protecting your back. 1. Exercise regularly. To keep your back strong, pay special attention to your core muscles, the muscles in your abdomen and lower back that are essential for proper posture and alignment. Ask your doctor to recommend specific activities. 2. Maintain proper posture when you sit. Choose a seat with good lower back support, armrests and a swivel base. Consider placing a pillow or rolled towel in the small of your back to maintain its normal curve. Keep your knees and hips level. 3. Use good body mechanics. If you stand for long periods, rest one foot on a stool or small box from time to time. When you lift something heavy, let your lower extremities do the work. Move straight up and down. Keep your back straight and bend only at the knees. Hold the load close to your body. Avoid lifting and twisting simultaneously. Find a lifting partner if the object is heavy or awkward. Diagnosing sciatica. Sciatica is a symptom that varies from one person to another and depends on the condition that's causing it. To diagnose sciatica, your doctor will first want to get your full medical history. This includes whether you have had any recent injuries, where you feel the pain, and how the pain feels. They'll want to know what makes it better, what makes it worse, and how and when it started. The next step is a physical exam to test your muscle strength and reflexes. Your doctor might also ask you to do some stretching and moving exercises to determine which activities cause more pain. The next round of tests for diagnosis is for people who have dealt with sciatica for longer than a month or of chronic condition, such as cancer. Nerve tests will allow your doctor to examine how your sciatic nerve is conducting nerve impulses and learn if there are any abnormalities. These tests may help locate the area involved and the degree to which the impulse is being slowed. Your doctor can get a look at your spine through imaging tests, which will help them determine the cause of your sciatica. The most common imaging tests used to diagnose sciatica and find its cause are spinal X-rays, MRIs, and CT scans. Normal X-rays will not be able to provide a view of sciatic nerve damage, but they can show bony abnormalities. They can push on the sciatic nerve or decreases in disc spaces that might suggest disc herniations. An MRI uses magnets and radio waves to create detailed images of your back. A CT scan uses radiation to create detailed images of your body. Your doctor may order a CT myelogram. For this test, They'll inject a special dye into your spine to help produce clearer pictures of your spinal cord and nerves. What are the treatments for sciatica? We will look at treatments for acute and chronic sciatica individually. Acute sciatica treatments. Most cases of acute sciatica respond well to self-care measures, which include over-the-counter painkillers such as ibuprofen, which are also available to buy online. Exercises such as walking or light stretching. Hot or cold compression packs help to reduce pain. They are available to purchase online. It is often helpful to alternate between the two. Not all painkillers are suitable for everyone. Individuals should be sure to review options with their doctor. Chronic sciatica treatments. Treatment of chronic sciatica usually involves a combination of self-care measures and medical treatment. Physical therapy. Cognitive behavioral therapy, CBT, helps manage chronic pain by training people to react differently to their pain. Surgery may be an option if symptoms have not responded to other treatments and continue to intensify. Surgical options include lumbar laminectomy, widening of the spinal cord in the lower back to reduce pressure on the nerves. Discectomy, partial or entire removal of a herniated disc. Depending on the cause of sciatica, a surgeon will go over the risks and benefits of surgery and be able to suggest a suitable surgical option. Exercises and stretches. There are many ways to relieve the pressure on the sciatic nerve through exercise. This allows patients to alleviate their symptoms on their own, reduce or avoid taking medications where possible, find longer-term comfort and relief for their condition during flare-ups. If you have sciatica, a GP may suggest exercises and stretches, prescribe painkillers. They might also refer you for physiotherapy, including exercise advice and techniques like massage, manual therapy, psychological support, to help you cope with the pain. Other treatments for sciatica. If your pain is severe and treatments from a GP have not helped, they may refer you to a hospital specialist for pain-killing injections, a procedure to seal off some of the nerves in your back so they stop sending pain signals. Surgery. An operation called decompression surgery can sometimes help relieve sciatica. Treatment options for sciatica. When you receive a diagnosis of sciatica, your doctor will likely give you tips for treating your pain. You should continue your daily activities as much as possible. Lying in bed or avoiding activity can worsen your condition. Some commonly suggested at-home treatments are 1. Cold. You can use ice packs or even use a package of frozen vegetables. Wrap the ice pack or frozen vegetables in a towel and apply it to the affected area for short intervals several times per day, during the first few days of symptoms. This can help to reduce swelling and ease pain. 2. Heat. You can also use hot packs or a heating pad. It's recommended that you use ice during the first couple of days to reduce swelling. After 2 or 3 days, switch to heat. Heat can help relax muscles in the back, which can spasm when an injury occurs. If you continue to have pain, try alternating between ice and heat therapy. 3. Stretching. Gently stretching your lower back can also be helpful. To learn how to stretch properly, get one-on-one physical therapy or even yoga instruction from a physical therapist or instructor trained to deal with your injury, if it's available. You may also look for free videos online to help you find the proper stretches. Make sure to consult with a medical professional first before starting a stretching routine. 4. Over-the-counter medication. Over-the-counter medications, such as aspirin and ibuprofen, can also help with pain, inflammation, and swelling. Be careful about using aspirin excessively, since it could cause complications, such as stomach bleeding and ulcers. 5. Regular exercise. The more you stay active, the more endorphins your body releases. Endorphins are pain relievers made by your body. Stick to low-impact activities at first, such as swimming and stationary bicycling. As your pain decreases and your endurance improves, create an exercise regimen that includes aerobics, core stability, and strength training. A regimen with these components can decrease your risk of future back problems. Always talk with a medical professional before starting a new exercise routine to make sure it is safe for you. Physical therapy. Exercises in physical therapy can help to improve your posture and strengthen your back muscles. Prescription medication. Your doctor might prescribe muscle relaxers, pain relievers, oral steroids, or anticonvulsants. Epidural steroid medication. Corticosteroid medications are injected into an area called the epidural space, which is the canal that surrounds your spinal cord. Because of side effects, these injections are given on a limited basis. Surgery. Surgery may be needed for severe pain or situations in which you have lost control of your bowel and bladder. It may also be considered if you have developed weakness in certain muscle groups of the lower extremity. There are two most common types of surgery. Discectomy, part of the disc that's pressing on nerves that make up the sciatic nerve is removed. Microdiscectomy, the disc removal is done through a small cut while your doctor uses a microscope. Is the sciatic nerve the only source of sciatica pain? No, the sciatic nerve is not the only source of what is generally called sciatica or sciatica pain. Sometimes the source of pain is higher up in the lumbar spine and causes pain in front of the thigh or in the hip area. This pain is still called sciatica. How can I tell if pain in my hip is a hip issue or sciatica? Hip problems, such as arthritis in the hip, usually cause groin pain, pain when you put weight on your leg, or when the leg is moved around. If your pain starts in the back and moves or radiates towards the hip or down the leg and you have numbness, tingling or weakness in the leg, sciatica is the most likely cause. Is radiculopathy the same as sciatica? Radiculopathy is a broader term that describes the symptoms caused by a pinched nerve in the spinal column. Sciatica is a specific type, and the most common type, of radiculopathy. Should I rest if I have sciatica? Some rest and change in your activities and activity level may be needed. However, too much rest, bed rest, and physical inactivity can make your pain worse and slow the healing process. It's important to maintain as much activity as possible to keep muscles flexible and strong. Before beginning your own exercise program, see your doctor or spine specialist first to get a proper diagnosis. He will refer you to the proper physical therapist or other trained exercise or body mechanics specialist to devise an exercise and muscle strengthening program that's best for you. Can sciatica cause my leg and/or ankle to swell? Sciatica that is caused by a herniated disc, spinal stenosis, or bone spur that compresses the sciatic nerve. It can cause inflammation, or swelling, in the affected leg. Complications of piriformis syndrome can also cause swelling in the leg. Are restless leg syndrome, multiple sclerosis, carpal tunnel syndrome, plantar fasciitis, shingles or bursitis related to sciatica? While all these conditions affect either spinal cord, nerves, muscles, ligaments or joints and all can cause pain, none are directly related to sciatica. The main causes of these conditions are different. Sciatica only involves the sciatic nerve. That being said, the most similar condition would be carpal tunnel syndrome, which also involves a compression of a nerve. Most cases of sciatica do not require surgery.